everyone, and welcome back to Group Therapy. I'm one of your hosts, licensed psychologist, Dr. Jessica Rabon.
I'm licensed psychologist, Dr. J.
And I'm licensed clinical social worker, Kristen Gingrich.
And I'm licensed psychologist, Kristen Casey.
Today, we are going to be talking about a topic that I am so passionate about, being a hospital-based psychologist, which is the intersection between chronic illness and mental health. So settle in, take a seat, and welcome to Group Therapy. Last week, we talked all about self-esteem and self-confidence and left you with this reflection question. What is a way you can show yourself love this week? Y'all, we got a ton of answers, so I'm just going to highlight a few, but make sure to go over to our Instagram and check them all out because they were so amazing. So some of the ones we got were, been struggling postpartum to show myself love. So my goal is to shower and give myself grace if I struggle.
Oh,
I love that.
yeah.
Like something as simple as, quote unquote, simple as showering. By taking 30 minutes out of the day to sit or walk outside in the sunshine.
Gotta have it. Sunshine.
Listen to my body when it says I am not in a safe situation.
I love that.
Yeah.
And then the last one, to be kind with myself and my self-talk.
That hits.
Yeah. And we got a lot of those ones talking about self-talk and things like that. So to start this week's episode, I really just wanted to start by sharing some statistics and maybe getting y'all's thoughts on things. So the first one I'm going to share, according to the CDC, 51% of Parkinson's patients, 42% of cancer patients, 27% of diabetes patients, 23% of cerebrovascular patients, 17% of cardiovascular patients, and 11% of Alzheimer's patients also have depression.
Wow.
Americans with diabetes are 2 to 3 times more likely to develop depression than people without diabetes. A 2017 systematic review found that people with COPD are 90% more likely to die by suicide than those without COPD.
Damn.
And then
I didn't
in
know
2000, yeah, I didn't know that either until I was looking up. And the last one I was going to highlight is a 2019 study found that risk of suicide doubles in the first year after a cancer diagnosis. It does vary with cancer and type. And on a more positive note, risk does reduce and stabilize as time goes on. But the fact that it doubles in that first year was alarming to me.
Damn.
That's crazy to me.
Yeah. So I guess to open it up, you know, we'd like to start with definitions. Like, what is a chronic illness? What are we even talking about today?
I capture it as like anything that lasts for a while, you know, that needs ongoing attention or care or medication management or something like that.
Yeah, and I think the definition only requires it to be a year or more ongoing.
Oh, yeah. Mm-hmm.
Which is why the breadth of conditions that can fit under it are pretty infinite. Any condition that's plaguing you for more than a year that requires treatment. I mean, that is everything and anything.
Literally.
Literally.
Mm-hmm.
Mm-hmm.
Wow.
If anybody feels comfortable sharing, like, what are y'all's chronic or experiences with chronic illness, either personally or professionally?
So I struggle with hypothyroidism. I've had it for, I don't know how long I've had it for, but I've had it for a while. It's managed now. I also struggle at times with a very low level version of alopecia, which is where your autoimmune system attacks itself and specifically your hair follicles. I do not have a severe case as I have hair, but I will frequently, under super high stress situations and major life changes, will lose like right here in like large patches. And then obviously mentally ill gang.
Yeah.
Here we are. Yeah, I have a neurological condition I know I've talked about a few times on here called kiari, which is essentially where your brain kind of slips into your neck and creates problems by pushing on your brainstem. It can block cerebral spinal fluid on the spinal cord, but you have a lot of neurological symptoms. They don't really know why your brain falls into your neck. It doesn't belong there, shouldn't be in there. But sometimes it's like your skull's misshapen in a certain way, or for whatever reason, your gray matter expanded in an area it shouldn't have. But I had to have decompression surgery 4 years ago, which thankfully for me, like the surgery did reduce my symptoms greatly. And it's a chronic condition that there's not a lot of help for. The decompression created more space in my neck base of skull area, so it's not as compacted, but they really can't push your brain back up into the skull. Like, so
Yeah.
I have a lot of symptoms. I have flare-ups. And truly, I'm grateful that there was a surgery that at least helped reduce the severity and frequency of the flare-ups. So, but yeah, I'm just thinking back from like when you get a diagnosis, whatever it might be, some of them creep up on you. But for me, because I was blacking out and like passing out and having all these really severe symptoms, how debilitating and blindsiding it is when you get a certain diagnosis of how life-changing that can be.
Oh, yeah. Because then you live your life so differently, you know?
Totally.
You have to. Yeah. I have several chronic conditions, but the major ones are I get chronic migraines with aura. So I like kind of see some weird stuff and then I can't really see out of one of my eyes. And then I just get this massive migraine. Like it's always right here, usually because of stress. I also have a medical condition. You guys know about this. I haven't been super public about it, but I am kind of recovering from a series of surgeries, you know, based on an infection that I had that I have to really manage now. So you have to like get blood work done and really manage symptoms. Also have blood sugar issues. So passing out and stuff, obviously for a different reason than Justin. So I always have to manage like what I'm eating and all of that. There was one more. Oh, I have a rare disease in my eye, in the right eye, like where my eyelid. It's weird. It's actually really interesting because I don't have much pain from it. But when I do, it's like, it feels almost like a tension headache, but like in your skull. It's like the weirdest thing. But the muscle that's over my eyelid and it connects to my jaw. And every time I move my jaw like really, really wide, my eyelids go a little crazy. So I'm a little like goofy looking sometimes. But yeah, I've had to manage that my whole life. Haven't had surgery. Thankfully, it's kind of gotten better over time. So Jess, what about you?
So I have Raynaud's disease. So basically when it primarily happens in response to cold, but my fingers lose blood circulation and they start feeling numb and cold, sometimes in my toes too. And then I've had chronic lower back pain since I was in high school after a car accident. That is manageable most of the time, but when I get stressed, because I carry stress in my back, it flares up significantly worse.
Yeah. I even think too, like, we could talk about this openly, right? And then I think about some of our clients who struggle. And I sometimes wonder, like, when you're experiencing a chronic illness and just so you don't have that social support, it must feel so isolating, you know, like you're just kind of dealing with it on your own all the time. It must be so tough.
Even thinking that the things y'all are putting out there, like, I know you well, like, I know y'all have talked about this in different times, but it's so different when you're hearing someone talk about something that you haven't heard of and you're trying to wrap your head around it and understand it, but you know, you don't really know what it is. You can't really understand it. You've never had that experience. And then you're thinking about how it must feel when they're going in front of different medical people and you're often faced with them knowing a limited amount about it.
Whoa. Yeah, because you almost have to hope that person not only has empathy, like the professional or whoever you're seeing, but you have to almost like, because you know your illness probably better than anybody, right? Because you live with it. But then when you're trying to explain it to somebody else, you have to hope that they understand like the severity and the intensity and what it feels like. And you almost have to hope that they could empathize to the level of what you're experiencing. And I would imagine for a lot of people who have those illnesses, like it's probably hard to describe it too when you're only have 15 minutes to talk to a physician about it.
Or even like before that, seeking a diagnosis. And I know, Justin, you kind of touched on this and I wanted to wrap back around. Like it can be so blindsiding to get a diagnosis. For other people, they search for a diagnosis for years because they're like, I know my body is having these physical symptoms. And, as somebody that works in a hospital, I have more insight into the process, but like even just thinking about, all the specialties. So you have your general practitioner, and they might run some basic tests, and it's like, oh, you're having X symptoms, so let's refer you to the neurologist. And the neurologist is like, oh, well, maybe actually this might be an endocrine disorder. So then you're referred to the endocrinologist, and and it's just this long process. And kind of going back to what you all were just saying of, you have to hope the professional sitting across from you at least like hears you, and if they don't know, has an idea of where to refer you to somebody who may be able to help.
Or at least are just willing to listen at first. I think we hear very often in the chronic illness world that kind of invalidation. When you bring a set of symptoms, and it's, my favorite is said in sarcasm, is it's then chalked up to be psychosomatic, which is something commonly I hear, especially with like, stomach issues or headaches or body pain, like, oh, it's psychosomatic, which some people, true. But a lot of times it turns out to be, something more than that. And sometimes can be really invalidating when your providers maybe chalk it up really quickly instead of maybe sometimes just running some of the most basic tests to open the doors to a lot of these things.
Yeah, I mean, that was very much my experience. Like, I had gotten my heart checked out. I had gotten my lungs checked out. I'd gotten my stomach checked out. I'd gone to my primary doctor. And of course, the default is, and I'm not at all knocking any of these doctors I saw or the profession, but their default, when they don't know something, they default to sort of what could be the low hanging fruit of, sounds like you could just be stressing yourself out. You might just be working out too hard. Is this possibly anxiety? And I'm like, I'm blacking out.
And some of them losing time.
Yeah. Some of them didn't. And again, some of them didn't know I was a mental health professional, a psychologist. And I'm like, yeah, I could be. Like, you don't want to be rude and be like, ain't no way. It's no way it's my trauma or anxiety or whatever. But the last person I saw was a neurologist. They did the MRI and they're like, oh yeah, like your brain shouldn't be there. So it was funny because it was like both like, thank God it's something, and now what? Because they're telling me you can't work out anymore. Yeah. You shouldn't be out of breath. You shouldn't move your head around. You shouldn't do anything that jars your head, like going on a boat or anything. I'm like, what the fuck? Like overnight, everything changes. And so yeah, it's just such an interesting journey. And it makes me, my whole point in saying all that was, it makes me think about how it's such a luxury as a therapist to have close to an hour appointments, investigating, sitting with, getting curious with. And the way a lot of our medical system is, they book themselves to get 10 minutes, 15 minutes. And again, I know some providers do a little bit more, but it just makes me think of how you uncover so much more with more time. And that's not how our medical system is structured at all.
Yeah.
No. When I worked for the VA, I was thankful that they had a chronic pain clinic. And I worked there for a whole year, and it was so eye-opening because you actually get to spend time with people who are experiencing chronic pain, chronic illness, and they have all the space to talk about it. Like, we would hold all these groups and support groups, and people would actually be able to just voice what was going on with them uninterrupted, and it was such a beautiful thing to observe, because I think people hold it all in because it's kind of invisible for most people. Most people you wouldn't know if they're struggling. So it was a great thing to observe, like people just being able to be heard in that way, because they, like you're saying, like they only have like 10 or 15 minutes to talk to anybody about this stuff.
Yeah. The amount of times, especially in the hospital, I've like gone to the, attending doctor or specialty doctor. I'm like, did you know this? And they're like, wait, what? No. And I'm like, how did you not know this like big thing? But I think that also speaks to, why a multidisciplinary approach for everything, but like especially chronic illnesses. And I know we haven't even dove into the impact of chronic illnesses on mental health is so important. Like not only all the like medical specialties, but psychology, like PT, OT, speak, like all of those disciplines, because we all have different roles. And to your point, Justin, like we can spend so much time. And I know, at least in my hospital, certain disciplines, so like our pediatric pain clinic, they do have, I don't know if it's one day a week, where they'll do like longer, like integrated sessions. But those are not the typical, in specialty, they get 30 minutes for a new, like maybe new patients 1 hour, but like specialty, they get like 30 minutes for an appointment. And K10, you just brought up chronic pain, like having only 30 minutes for a chronic pain patient, like
especially with all the barriers that they experience and all the, just say you have a pain flare up and you're trying to get through an appointment. I mean, it's just, there's so many things.
Oh, absolutely.
KB, I kind of already bridged this gap in mentioning it, but it makes me think about, the ways chronic illness impacts mental health and sort of the ways mental health is chronic illness. It like kind of goes this way and it comes right back.
Would you look at that?
Look at that.
Yeah, when I was working in the pain clinic, we would, read a lot of research about depression, notably, because a lot of the people there had major depressive episodes, recurrent ones. I mean, who wouldn't if you're experiencing something like that on top of all the other things that people experience? So we were noticing that like when people have depression, like Jess was saying before, like they're more likely to experience a pain flare and vice versa. Like they might actually be more likely to experience a major depressive episode just based on the fact that they have chronic pain. Like, and I know I'm just talking about pain here, rather than chronic illness, but I just think you need well-rounded care if that's the case. Like you need more supports.
Yeah. I mean, I have so many thoughts just based on the nature of my job, but like, what comes first, the chicken or the egg? So I have seen individuals that, have major depressive disorder, and we know that people with major depressive disorder are at higher risk for chronic illnesses. Like, so if you think of like diabetes, for example, heart disease, if you're not taking care of yourself because you're so depressed. But then on the other hand, working primarily with children and adolescents, just getting the diagnosis can impact your mental health. Like Justin was saying, it's an interesting dichotomy I see in the hospital a lot. The uncertainty of a diagnosis is usually more stressful for people than actually getting a diagnosis. But exactly what you described, Justin, like, okay, now I have a name, and then what? Prolonged hospitalizations alone can be, negatively impacting your mental health. And although this applies to everyone, especially working with teens, like the grief, and we kind of touched on this in our grief episode, of the life they had.
Yeah.
Like if you're diagnosed with a chronic illness, like not from birth, it's like all these changes that you have to make, feeling different. Then you add on top all the physical symptoms that come with having a chronic physical health disorder. I don't know, logically, it just makes sense that your mental health would be so poor.
Oh, yeah.
It all just begins to tie into one another.
Right.
And really looking at what that looks like long term. And one of the things you talked about was like, with that diagnosis, and, you may have a reaction when you get that diagnosis, and then you like enter like a depressive state. But then there are some people that with time and they learn how to manage it. Like I'm thinking of someone that I know that got diagnosed with diabetes. They really struggled at first with the lifestyle changes that came with that, and needing to like now wear a pump and doing all of that. And now as an adult, and they've learned to manage it, that has, I wouldn't say gone away, because they still have their moments of struggle, but as they've learned to like manage that and process that, it has even shifted for them. So there's also the time too of like, what does mental illness look like and your mental health look like over the course of time as well?
I never thought of it like that, because it does change. Like you're saying, like if you acquire something or you learn of something, and I do wonder how it affects people's concept of like their own self-efficacy. Like as they're learning to manage it, they're probably feeling like, wow, this is like a lot. Am I going to be able to do things that I want to do? Am I going to feel fulfilled in that?
Yeah.
That's tough.
Yeah. That installation of hope is so critical.
It is.
I think for anyone out there listening too, it's like, it is so important to absorb that piece that KBI was saying. It's like things can change and things can transition. I was so depressed. That was the lowest for me personally. Like, I've gone through things, as we all have, in different ways, but for something like that was starting from like internal, it was the hardest thing I've ever faced, and the most like, I don't know if I want to be here. Like, if my life's going to be like this, I don't know how I'll handle that. And it's not like trying to be dramatic or whatever, but like, I know a lot of people who face really hard chronic roads. It's a question that comes to your mind of like, how bad can this get? And how bad could this create my existence? But definitely, and I know exactly what KBI was saying, like for many of us, it's like you need time for the initial storm to pass and to go down a treatment path. And you don't know exactly where that one will go. And for me, like a year post surgery, I still felt nothing had changed. And it was wild because like as the months went by after a year of my surgery, it's like it's weird how things started to shift. I'm like, I don't feel as foggy. I feel like I finally have energy again. It's like, I'm not having these speech spells. Like all these of my really plaguing symptoms were like becoming less and less. And I was like, wow. Like, again, I had changed some things. I started really working hard on inflammation stuff, which I don't need to get into, but impacts neurological things greatly. And I just started trying different things, but it's exhausting, it's frustrating, and it's very scary in the beginning.
It definitely is. I really relate to what you said, Justin, with my own struggles this year, like with my own medical stuff. I was like, I'm in so much pain, I don't want to wake up. Like I was just like, whoa. And for me, it actually started during our sleep episode, which was chaotic, and it made me happy. Thank God. That was like the worst pain flare I was having. And I was really thinking back, and I was like, wow, if this doesn't change, then like what, like you said, like what is the rest of my life going to look like? Do I actually want to live a life like this? And you almost have to get adaptive and creative and like say, okay, this isn't the life I anticipated. So you grieve, and then you're like, okay, I'm going to have to live life with some help. That's just how it has to be. And like you said, with the treatment path, I mean, sometimes that path leads you to another. And I think some people are apprehensive to start because they're like, oh my gosh, this feels like such a big journey. But the key is just taking that first step and starting anywhere, just to kind of make yourself feel some sort of hope. I think that's the key.
Yeah.
100%.
Absolutely. Yeah. And the other thing I'm thinking about kind of with like the journey, because I do agree that, initial diagnosis, symptoms, etc., when they're not being treated yet, you're just kind of figuring out what it is really hard. And then I also think of, flare-ups and, if symptoms become worse during stress, so you might be doing good, then something else in your life happens. And not only is that emotionally impacting you, it is also impacting your physical health or the circumstances outside of your control that, I'm even thinking like medication shortages and things like that can really impact your disease process.
Oh, yeah.
Well, I just think of the when you say that, the thing that comes to mind is diabetes and the impact of medication for that illness, and it being owned and privatized at this time. And I don't know if it's fully private, but like it's so expensive to pay out of pocket, and like
it's crazy.
knowing that there's individuals who go to the pharmacy to get pet insulin, which is the same thing, but in order to get it more affordable, or individuals who, and again, this could be for any illness, but I just hear about it most frequently for diabetes, people who space out and use less because they know how expensive it is. And how that's not, how treatment really isn't accessible for that. Just knowing like my sister-in-law, and different times when she didn't have the insurance coverage she needed. The
system isn't made with people with chronic illness in mind, in my opinion. There's just like so many barriers, like financial barriers, like even like if you think about medical literacy, like nobody really teaches us about medical conditions and chronic conditions. So like if you're experiencing symptoms, I mean, what do? You just take ibuprofen or you just try to make it work. I mean, it's just, I think with education too, I mean, there's just so many barriers for people to get the help they need and even to know where to go. I mean, it's wild.
Yeah. KBI, you bringing up diabetes reminded me of this memory. So my best friend from college has type 1 diabetes on a pump. And I remember us being freshmen in college. We went to CVS to go get her insulin. And with insurance, it was over $400 a month.
Oh,
Jesus.
And like, I still have this distinct memory of the like pharmacist being like, you know, it's going to be $420 whatever dollars. And she was like, yeah. And I remember looking at her and being like, what? And she was like, yep. And she's had type 1 diabetes since she was 4 years old. Like,
That's so wild.
And with insurance.
Yeah.
That's not affordable.
This like makes
people.
me so sick. Like I can't handle it.
And the reality with that, and with a large chunk of certain chronic illnesses, you have to have that to live. Like there's a lot of you know, chronic illnesses out there. Like if my levothyroxine suddenly became $400 a month for me, I would probably make the decision and say, you know, it's not going to kill me. I can't afford that. Not that I should have to make that decision, but there's a lot of individuals out there where that is their reality. And like you said, K10, like the system is just not built. And then the impact that that has on your mental health.
That's what I was going to say.
Even then, like I think of your mental clarity as well. So when you're dealing with a lot of those things, like you don't even have the mental clarity sometimes to manage. You don't have the mental clarity to problem solve to the point, or be able to sit there and use like CBT or whatever. Like, I don't know. In that moment,
I mean,
like you don't have that. And so that's really a struggle.
Yeah. And I know we have listeners like literally all around the world that listen to this podcast. We love you. Thanks for being here. But it's like, you could pull back and be like, oh, that's not my system. Like, why are you talking about this? The stress and the barriers that get put up for how you, in whatever country and system you live in, of what's there to take care of your health absolutely impacts mental health. Taking off work, losing money in that respect. Some of us need to get transportation. Some of that's far away. Some of us are waiting on prescriptions. But there's no doubt. I mean, the American healthcare system is broken. It's trash. Again, we could get into politics or whatever, and this is why it matters, because if you live in a system like we live in, there's so many obvious signs that it's broken and unfair that someone could literally go bankrupt for getting cancer. That's our system that you live in.
Absolutely.
How in the hell would that not create anxiety?
It's insane.
It's laughable to think of like, well, how's it relate? Because you're going poor to treat your cancer. And we rely on GoFundMe's. Like, it's absurd. And I know a lot of listeners out there are like, of course, this is what we live in here in America.
Yeah.
I think we just get numb to it because what do? We vote, we advocate all this stuff, and it's hard to change, and it's like, I just think too, like, even with my stuff, I've had a series of like 4 surgeries this year already. And with my health insurance, it was actually more expensive. So even that's confusing to navigate. Like, even if you have health insurance, you don't know if something's covered or not. Right. So thankfully, I come from a place of privilege. I had savings, I was able to do that. But if I didn't have that, it was a life-threatening condition. What am I supposed to do? Be like, oh, whoops, see you in the next life. Like, what am I supposed to say?
Right.
It's wild. Yeah.
Well, I mean, I got that TMS treatment for my chronic depression, my treatment-resistant depression. And I love my insurance. It's really great. It's state insurance through the government, like, because my husband has a government job. And so it's really awesome. Right. And got the prior authorization after I had to give them documents upon documents upon documents to prove that I needed this treatment. They said, go ahead. You're approved. Prior authorization. to then start getting letters saying, we're not approving this. We're not approving this. We need more information. We need more information. And I'm like, and I'm literally, all I'm doing is sending them the same information. And granted, again, privilege, and was able to do it, but I still have a $600 balance of a copay that I've racked up over the course of the 3 months that I did the treatment. And so again, like, if you're not in a place where you can do those things, then you don't have the access to the treatment that could be really beneficial for you.
I think that's why too, like when people are going through stuff like this, the last thing on their mind is, let me see a therapist, right? Because they're like, I have to just stay alive and manage my life, right? And people say, oh, therapy is so helpful. But I think when you're in a state like that, you just think almost therapy is an option because you can't afford it, or that you don't have access to it. And it's honestly low on the priority list when you're dealing with a chronic illness. I mean, it's just, unless the chronic illness is depression and you have that, KBI, like you have the access to that. But even still, you have to pay for it. I mean, it's a lot.
Yeah. And one thing you just said, K10, low on the priority list, like I'm thinking of so many of my patients that see multiple specialists, like multiple physicians, multiple times a month. So they're already having 5-6 medical appointments. I work with peds patients, which means their parents have to take off work. They have to take off school, things like that. They're not going to add an additional appointment on top of that because they're already having to adjust their life so much around their illnesses and treatments and interventions. So we've been talking a lot about like medical specialists, interventions, barriers, but if somebody does have the privilege to see a therapist, like if you have worked with individuals with chronic illness, what are some of your like go-to interventions? Like Justin, I know earlier you mentioned hope, and that's not necessarily an intervention, but like instilling hope, or what are some of your other go-to?
Did she freeze?
Let's assume that didn't go through, Jess. You froze on all our end.
Oh, okay.
Yeah. So you're going to have to say all that again. Yeah.
All that again. Okay.
Okay. Ready? And because it probably did record, but we can't assume that. So let's try that again.
Smart.
So we've been talking a lot about, barriers to care, medical treatments, interventions, but as mental health professionals, if you've worked with individuals with chronic illness, what are some of your favorite or go-to interventions for, either helping with the chronic illness and managing those symptoms, or just the mental health aspect related to their chronic illness?
So one of my favorite ones is activity-based pacing. Have you guys heard about it? Or time-based pacing? Yep. So for people with chronic pain, a lot of times they're like, hey, I woke up pain-free. What do I do? And they do all the things because they don't have a pain flare. And then the next day, what happens? They have a really bad pain day because they overdid it. So what we do is we actually help them, depending on the pain, depending on where it is and all of that, we could help them pace their activities based on time rather than completing the activity itself. So we might say, hey, do 15 minutes of chores rather than trying to get all the dishes in the dishwasher, you know what I mean? And then just use that as a scale to keep moving. Because if you try to do everything all at once, then you're gonna crash. And then over time, you'll get more done and you'll feel really good. So we try to look at it based on time rather than the activity, depending on the person. I'm just thinking about chronic pain rather than chronic illness, though. What about you guys?
Yeah, chronic illness pulls a range of what type of intervention would be most helpful. But like where my gut's going, I'm thinking about all the different clients I work with. A lot of it is paying mind to the emotion focused, meaning grieving certain aspects of our life, allowing time and space, as KBI was saying earlier, to really hear what somebody's going through. Because the amount of times my chronic pain, chronic illness patients will come in and they'll want to process what just happened at their doctor, at their neurologist. They'll want to use therapy to emotionally talk about and sit with the new news, the new treatment plan, how they're feeling about this and that, because they're not getting that anywhere else. And I think it's really important because, again, our emotions matter. They tell us which way to turn, but these aren't cognitive problems in that you're not having some sort of quote unquote thought error about something. It's like you're emotionally being overwhelmed with the challenge that's right in front of you. And it's real. It needs validating. You need to process those emotions. And beyond that, like when we are in that emotional space, it does lead to like problem solving. And sometimes like solution focused of what would be most helpful for you going into, this weekend. What would really help you reset? What would help you explain this to your family because you're worried about talking to them about it. But in thinking about all the different ways it comes up, it pulls a lot from you as a therapist because you can't assume, not like you can with anything, but you really can't assume what someone's going to be needing.
Mm-hmm. Yeah, it definitely for me is dependent on the type of chronic illness. So like I see a lot of chronic pain and exactly what K10 said. Also, I do a lot of like mindfulness activities with pain. I do a lot of values work from ACT, especially with new diagnosis, because with that grief, but also, kind of that catastrophic thinking of what's my life going to be like? I don't want to live like this. So, focusing back to the values. And a lot of times, if there's, and I think of diabetes too, my teens that have come in with diabetic ketoacidosis multiple times. So we need to address what are the barriers to adhering to your treatment. And depending on the barriers, treatment's going to look different. Maybe it's some motivational interviewing. Maybe it's some behavioral activation. So it is really dependent. And then obviously just any intervention I would use for like depression, anxiety, things like that, enhancing coping skills. Know what will enhance our knowledge.
See, that one was good.
That was actually fire.
Okay. I was like racking my brain.
Let's go.
The Google Scholar Shorts.
Boom.
So since it is still September, my question to you all is, how do you think chronic pain impacts suicidal behavior? But I'm going to throw a twist in there. Of a twin compared to their twin without or with less chronic pain. I'm so excited about that.
I don't know the answer though.
KBI's face.
See, I get the twinning thing, so I think it also increases when the twin. I think both increase.
Oh, you're banking on the twin connection. See, I was going the opposite. I was saying twin with significant. But I also think.
Oh, keep going. Sorry.
Oh, I was just immediately assuming the twin with chronic pain, statistically significant suicidal ideation and the gamut. But I like your thought, KBI. I wouldn't have thought of that.
I just think Jess likes to trap us too.
Oh, she does.
So
mess with us.
Like, I don't like. Obviously, Jess would pick. She could absolutely pick a completely straightforward study, but I also don't believe that.
Yep. I feel
agree
with that.
She wouldn't ask that question. She wouldn't ask that question if there wasn't a twist somewhere.
Shows your social intelligence. Yeah.
Yep. Well, you know what I think she does? She goes on Google Scholar and she just like types in stuff and finds like the craziest study. And she's like, this is going to throw them through a loop this week. I feel like that's what she does every week.
I do read a lot of studies each week to figure out which one I
She looks like a cackler. She goes,
someone in the questions this week literally gave us a Google Scholar link for Jess.
Oh,
I love that.
That's like the second person. Okay, so
oh my God.
The first few things I'm going to say probably aren't going to surprise you. So across all individuals, so this was a study, 10-year longitudinal twin study.
Ooh,
so for any individual that scored one standard deviation above the mean for pain conditions had significantly higher risk of suicidal behavior. However, after they included all the pain conditions in a regression model, only chronic fatigue syndrome and bladder pain were related to suicidal behavior, which was really interesting.
Say those again. I'm so sorry.
Chronic fatigue syndrome and then bladder pain.
Fascinating.
Were the only two that were uniquely associated with suicidal behavior. Then individuals scoring one standard deviation above the mean on the general factor, so general chronic pain, had 51% higher odds of suffering later suicidal behavior than those at the mean or below. And then when they looked at specific factors of pain, somatic symptoms factor was also statistically significant. However, this is where we get to the twin. Interestingly, so they looked at twin data. So that was across all twins. But then when they compared dizygotic and monozygotic, so fraternal and identical twins separately, the results remained the same for the fraternal twins. So higher pain was associated with increased suicide risk. But when they looked at identical twin pairs, regardless of which twin had chronic pain, both twins had the same risk for suicidal behavior later in life.
See, wow. KBI knew it.
KBI read it. What if
I know KBI actually read this study?
What if Jess sent it to KBI and they're on like Schema or something like?
No, guys, it's so logical. It's so logical though. It's right in front of your face.
You're right.
I didn't think that though initially, but I was like, that's so interesting because we hear chronic pain, suicide. But if you're a twin, an identical twin, it doesn't matter.
Oh, wow.
It also goes to show like how we know like nothing about like the body and the brain. You know what I mean? Because even the stats dropped at the beginning. We have no idea why 51% of Parkinson's patients, also have depression. Yep. And only, I'm putting in quotes, only 17% of cardiovascular patients. Like we don't know why. What is it about Parkinson's that over half do? But like if you're dealing with something cardiovascular, it's 17 is relatively high, but not high compared to 50. Again, I go on and on, but it just shows we don't know crap. But it feels like we know a lot.
Oh yeah.
We haven't even, go ahead.
Oh, I just thought it was super interesting. So one of the things Jess talked about was the bladder pain.
Yeah.
Because you know what that made me think of though? It made me think of older adults and UTIs, and they tend to, and a lot of times they see that increase, especially in dementia and Alzheimer's patients.
Yeah, I've heard that.
And so I again, there could be no connection there whatsoever. But like, I just thought like bladder pain, like it just made me connect those two things. I hope that makes any form of sense.
It does.
No, that does. That's a really good connection.
Yeah.
What were you going to say to K10?
I lost it because now I'm so excited about what KPI said, so I don't even care.
Yeah.
That was amazing.
She's so excited about bladders.
Bladders. No, I just think like, I don't know. I'm like in deep thought too, because we have so many organs and it's like weird to think that one would be in pain, but we have so many of them. It's like, my God, it's interesting that's connected anyway.
Yeah. And as all things are, but like pain is so individualized. Like I know on a very superficial level, this is not equating, but we joke about on this podcast about like what sections of the body we felt were most painful for the tattoos we've gotten because we're a tattoo crowd. But like just the individual differences in that. And again, it's like we're just talking about a needle and skin, which seems like it would be a really good controlled variable. But you get such wide range,
It's wild.
Like, people being like, this section was the worst for me. Like, and other people are like, no way, the ditch. No, like you do hear variability.
Yeah.
And then there's like even research on, like redheads have higher pain tolerance and require more anesthesia and surgery. Like things like that you're just like.
Fascinating.
Well, and pain tolerance, differs for individuals as well. Some people, like I can think of so many patients that they're either a 0 or a 9. Like there's no in between.
Right. Fascinating.
And others that are like, I'm like at a 4, and we're like, you're only at a 4? And like you just were in a horrific car accident and you have and you're at a 4, and they're like, I'm like, you're sure.
So variable.
Yeah.
Even that perception of pain changes the way that you even view your illness too, I'm sure. Like if you're in so much pain, you're like, fuck this, but if somebody else is experiencing the same thing, they might be like, oh, we have the same condition, but here I am, I'm doing all these things, So I think it's easy to compare to even just say you're in a support group for a chronic illness that you have, you can't really even compare your own pain or experiences to other people too. It must be so lonely and weird.
or even how your pain can change over time and just getting used to it.
Yeah.
And like how your body just creates its own, like its own memories and its own reaction and things like that. Like,
yeah. And how pain correlates literally with every mental health thing. It's like as pain goes up, I have yet to see anything it doesn't. It's like pain goes up, depression goes up, pain goes up, anxiety, pain, panic, pain, OCD symptom, everything. It just feels like, and again, I'm sure there's something out there maybe we don't have that data on, but it feels like pain is like a universal thing of when you're experiencing it, it's hijacking and increasing all the symptoms you don't want.
Yeah, absolutely.
Yeah.
But one thing we definitely do want
are the polls.
Oh, the polls! Why don't we go to them? Skip all our heels a little bit.
Justin did the polls this week.
I actually did them. I've gotten, hey, listen. Sometimes you get plenty of help from your besties in life, all right? We don't need to go into social loafing or, holding on by a thread or being the bad person in the group project. I rely on you guys and validate your existence in terms of being thankful. Being thankful for you.
Kiss ass.
100%. And of course, you better. If someone helps you out, come on. Hey, we asked you some questions. First one, do you suffer from a chronic illness? Yes, I'm not sure, or no, I do not. What do you got?
Ooh.
I feel like yes is going to be number one.
Yeah, any numbers? What are you thinking?
64%.
All right.
I don't know.
I want KBI to go because she always puts weird numbers in.
She's going to be like 3.
I fucking knew it. I'm just going to go 40. Fuck it. Go ahead.
Next one at 46% yes. Oh. Followed by 36% no, 18% I'm not sure.
Okay.
And that's interesting because it relates to what we know about what percent of Americans have a chronic illness. And I said, is it 25%, 40%, 60%, or 75%?
I don't actually know this one.
The right answer is 60% of Americans.
That's what I guessed.
It fooled our audience. Like,
did they say 40?
Pretty surprising to them. They said 40%. But I was a little surprised too. My internal guess, I'm being totally honest, I thought it would be around half of everyone. So 60% was above what I was thinking.
But if you think about it, all of us named different chronic illness. Exactly. None of us have the same chronic illness.
Nope.
And we're 4
out of 4.
Relatively young, healthy.
Yeah, speak for yourself.
Healthy.
I was about to say,
hey, I'm young.
Objectively.
Wow.
Individuals.
So you're calling me youthful? Oh,
that's like what did you say in the text the other day, KBI? You're calling me responsible or competent or something?
You're calling me. I forget what it was. I don't remember, but yes.
It was competent. I was like, you would probably be competent to stand trial. I said nothing about you.
It's always said. Nothing
Context.
More. Context. If you do have a chronic illness, what impact would you say it has made on your mental health? A big impact, a little impact, no impact, or I'm not sure?
Big.
I want to say a big impact, yeah.
Mm-hmm.
It was a big 67%. Big impact. 26% said a little, but yeah. And then 7% said I'm not sure. So
I was about to say, so that's like almost everybody.
Yeah, it's having an impact.
I was trying to do math. It was 93.
Real.
93.
I can't even calculate a tip at dinner without using my calculator. Anyway.
That I have that trick down.
$2 every $10.
Yes, 20%. It's funny, I don't think of it that way, but
really?
Yes.
I take that first number and times it by 2. So if it was like a $50 meal, you times that by 2. If it's like 59, I might round up. You know what I mean? But if 20% should be pretty close to whatever that number is.
I'm going to practice.
Anyways.
$2 for every 10.
I thought you were going to say $2 for every meal. Like, what?
I thought you were saying that too, and I was about to be like, listen.
If there is one thing I am, it is a bomb-ass tipper.
We are similar.
I have observed that in real life, so I could confirm that.
Bomb ass tipper. Well, that sounds like it's bad. I'm a great ass tipper, like 20% minimum all the time.
I think both of those could be misinterpreted, but we'll move on. If you don't mind sharing, in what ways has a chronic illness impacted your mental health? So many responses. Not being able to keep up with my friends, my own age. I get sick a lot. I get sick easily and miss out.
Mm-hmm.
Someone else said, my chronic illness is invisible. Definitely a big thing, something we haven't talked much about yet.
Yeah.
But people think I'm making my symptoms up because I look, quote, just fine.
Yeah. Mm-hmm. I felt that.
Someone else said, everything's impacted my job, doing housework, doing hobbies. I go through isolation, burnout, inability to do things you want or need. So people are saying it affects different parts of their body where they feel sensation, increases in anxiety and depression.
Mm-hmm.
Yeah, a lot of people talking about increasing anxiety specifically. Yeah.
Mm-hmm.
People doubting what they're feeling because of medical providers minimizing it.
Oh, yeah, that's not something we touched on, but yeah.
Someone else said something similar, harder to connect with others because they're not experiencing what I'm experiencing. That is hard. Yeah.
Mm-hmm.
Really appreciate y'all sharing that. Anxiety, panic attacks, some agoraphobia. Ooh, I think we have a question coming up about that.
Mm-hmm.
But yeah, grief, loss, all the things can get brought up. It really is interesting in thinking about chronic illness of like, it makes you think like, what mental health couldn't it trigger? You know?
Yeah.
Mm-hmm.
Yeah.
It feels like the gamut is like everything. It could make us feel any type of way.
Absolutely.
I could have sworn there was a study a while ago that said like, just on like a, Jess, you're going to know way more about this than me, I feel like, but like just on like a organic brain like level, like it's like a similar neural pathway, like brain and depression or something, or pain and depression.
Mm-hmm.
I have to find the article and send it to you guys. I was reading it a long time ago. I was like, that makes so much sense. Like everything increases as pain increases, you know,
well,
but
pain and anxiety too. I talk about the pain anxiety cycle so much because also if you think about a lot of chronic illnesses, I was talking to a patient about this recently. If you have for example, pulmonary condition. So you have difficulty breathing. Well, if you start having difficulty breathing and then you get anxious that you can't breathe, and one of the ways your anxiety manifests is by not being able to breathe. Like it, or same with like a heart condition. If you feel pain, chest pain, anxiety. A lot of people with anxiety or depression get muscle tension. If you have generalized, like, it's just so, but yeah, the brain pathways as well. The body is a wild thing.
It's insane.
Mm-hmm.
You know what else is wild? These group members.
I knew you were going to call our group members wild things. In my head,
Wild things.
They're nice people.
You make my heart sing. Anybody?
We're all wild things.
No one?
I don't know what that is.
I only know it. I only know it from the Charlie Sheen movie.
What is it?
Major League.
Major League. That also remember that I was watching that movie at like 8 years old.
Wow. That yeah. Mm-hmm. Yeah. Says a lot.
Yeah. I had very unstructured time as a child.
That's the nice way to put in it.
That was actually I'm actually really proud of you for saying it in that way. So
very unstructured time.
Yeah. Rebecca from Singapore asks, what are the challenges faced in diagnosing and treating mental illness in individuals with chronic illness?
Start us off, Jess.
I was about to say there's so many.
Yeah.
So like for me, for example, I never want to overpathologize an individual. So, you know, with the diagnosing and treatment of mental illness. So when somebody first gets diagnosed, like we said, depression, anxiety are normal responses to a life-changing diagnosis. So I think one of the challenges is making sure you're not overpathologizing. I think another challenge kind of that we've already highlighted is is therapy even on their radar? Are they even going to seek out this diagnosis? Are we even going to be able to help because they're seeing so many different providers? Symptom overlap as well. I kind of just alluded to this. Like, are their physical symptoms due to their chronic illness? Are they due to anxiety? Are they due to both? How do you tease those apart? And then, like, because I mean, unfortunately, just how our mental health system is right now with the DSM, it's just based on a list of symptoms. Yeah. And there are like caveats in pretty much every diagnosis, like symptoms cannot be attributed to another mental health condition, like physical health condition. So I think, you know, with that all being said, I think it's so important, one, that you have, if you're working with individuals with chronic illness, you have training in doing so. So you kind of have understanding, awareness, but also spending time really kind of dissecting not only their chronic illness, how it impacts their functioning, what mental health symptoms are they experiencing? Is that related? Because we talked about like brain fog and stuff. Is that depression, or is that ADHD, or is that a neurological disorder?
Yeah. Right. Yeah, and I bridge from exactly that. And it's like, is the chronic condition impacting sleep goddess, that leads to the symptom? You know what I mean? There's so much, and I mean this in a good way, of like, as a therapist, I feel like there's so much to investigate and get curious about. Because it's
absolutely,
we're not just sitting in a lane being like, oh, that's depression. You're depressed, so it impacts sleep. You really have to tease out and be like, tell me about your experience. Tell me what it feels like when you get ready for bed. And because stuff gets so nuanced, and it's like, you can assume it's depression is running the ship or whatever. And then lo and behold, it's pain. Pain is impacting sleep, which creates, you know, they're really only getting a couple hours of restful sleep a night. And then it's like, oh, here's an intervention point that maybe we can work on. But yeah, so much of exactly what Jess says. And it is a team effort, because a lot of times I am like, okay, when was the last time you went to your neurologist? Like, I often feel like I'm structuring and coaching to get them to be like, okay, why don't we put an appointment in? And then sure enough, next session, like, I got an appointment, I'm going to see them then. But you see people organizing, taking care of their health, because you start connecting the dots in the open space that psychotherapy provides.
Oh, yeah. No, I really relate to that. I was thinking about sleep too, Justin. And I always think, like, whenever somebody reports that they have a chronic illness, I always think there's more that meets the eye. Like, there's more to it than whatever they're saying, because I notice that people with chronic illness have a tendency to like minimize their symptoms too, because they've maybe been invalidated and stuff like that, and they don't want to appear like a burden. So I think that that's part of it too, of like, is it insomnia or is it pain flares that are waking you up at night that really impact the way that you actually structure your day and your sleep? I mean, because then is it an insomnia diagnosis or is it something else? Because it's most likely, in my opinion, something else, you know?
Yeah.
Also, I'm going to give myself credit. I bashed the shit out of my knee. I don't know if anybody heard it.
Did I hear it? It was a bomb going off. I looked right at you as your whole camera shook.
And I held it together because I thought I was going to cry.
Your face changed. Your face changed.
I hit so hard underneath my desk because there's like a metal bar. And I was like, Jess is sounding so smart. Don't interrupt it.
Jess always sounds smart. There will be other opportunities. Oh my God.
you can scream.
Jess wakes up with an IQ of like the highest threshold every day. So it's fine. Oh my God.
Jess wakes up to her alarm that gives her the next Google Scholar article. That's what it is.
Wait, other psychologists will get this, but
have like inspirational quotes, but it's fine.
Jess wakes up to Chat GPT asking her question.
Just wakes up to other psychologists will get this. Just wakes up to like just mastering block design of the like within like the first go. Like,
it was such a neat joke.
Me sitting with my master's degree.
Sorry, I'll explain it. It's like part of the IQ testing. You have to like move the little blocks around. Yeah, it's so cute. But like
perfectly fine with my master's degree.
That's actually my alarm clock. It's lots of fun.
Wow.
I'm creating new ones for the next version
We love
of
it.
the whisk and the
We
waste.
love to see it.
Anyway, hey guys, is your knee okay?
Sinead's good.
It's
Oh yeah,
fine.
is your knee okay?
It's fine. It was a struggle there for a moment. I can't wait for anybody watching, go back about 2 minutes and just watch my face change.
You'll
I
hear
cannot
it
wait
in
to
the
watch
audio.
this.
It was a bang. I looked straight at your face as you were wincing.
I heard something, but like you're so unhinged that I just thought it was you just being reckless.
Falling out of your chair.
Yeah. Anyways, anywho.
This is from, apparently, they don't want to tell us any information. They want to know.
Be nice. Some people want to be anonymous.
That was non-judgment for KBI.
She's in pain. Just let her. She's in pain.
There's a brain fog, okay? How do you work around protecting yourself when your condition isn't seen as serious or noticeable to most?
Ooh.
I feel like I've had to learn to accept that some people just aren't going to get it.
Mm-hmm.
Mm-hmm.
And it's a painful truth, but it's definitely true. It's not my job to convince you of my truth.
Yeah.
The
Yeah.
real ones, they care enough to listen, get curious, do a Google search. It's not that hard. To collect a little more info or just be curious. And and the others, it wouldn't matter how many YouTube videos you showed them. They're not going to get it. They're going to look at you and be like, you seem fine. You know, you seem happy. Just need to exercise and get more sunlight. Again, messages we've been told when you have a chronic illness, when people aren't trying to get it. But it's not our job to convince them. It is disappointing. It's painful, especially if it's someone you care about. But I hope for whoever you are, wherever you are, that you find people where it feels like they genuinely care to find out. Because again, there's unlimited conditions out there, but people you want to connect with, they're going to be curious about you.
Mm-hmm. And even if they don't understand, they'll try to imagine what it's like.
Yeah.
They'll try.
Yeah.
Like, you don't have to understand to really have empathy, you know? So I echo everything Justin said.
Yeah. The only thing I would add is kind of on the same vein. I always tell my patients in the hospital, because a lot of them are like, what do I say when I go back to school and I've been in the hospital, things like that. And I say, nobody is privileged to your information unless you want to share.
Yeah,
It's true.
And so,
True.
because I think a lot of times people with chronic illness feel like they have to explain themselves, like, oh, I'm sorry, I can't go out. I'm having this pain flare up or this and this and that. Like, no, you don't have to explain yourself. And I think that takes back your power. Like, it's the ball's in your court. So going back to protecting yourself, and then I could go into all this psychologist questions of like, what do you mean and stuff. If there are people you feel like you need to protect yourself from, those are probably not safe people and they're not privy to your information. But, you know, I always work with my patients on a couple like one-liners that like is kind of their go-to to kind of have these phrases, whether it's, you know, I'm having a pain flare up today. I will not be able to attend. If people ask questions, like that is all the information I feel comfortable sharing. Like, and just, it's not rude. It's just because it's also energy that you're giving out, explaining yourself.
Right.
And that's going to exhaust you as well.
Right.
Elise from Florida asks, is it common for a chronic illness to lead to agoraphobia, mostly due to fear of feeling very sick in public?
Yeah, what do you think, KBI?
I mean, the first thing that I thought of is like individuals who have IBS. Like they constantly, like they struggle to want to go anywhere that they don't know, like in and out, because they're worried about the bathroom situation or things like that. So yeah, I think it is common for individuals to become agoraphobic or location specific.
There we go.
In that, and have like their safe places that they go for fear of not having a bathroom for fear of, maybe throwing up in public or whatever it may be.
It's so true. I really relate to that too, because when I was going through my medical stuff, I was like, even telling my friends, like, I could only go to certain places. I could only be there for like 30 minutes. That's like my threshold. And like anything after that, if I'm not experiencing a pain flare, like it's a bonus, but let's commit to 30 minutes. And it's hard to get your friends on board with that if they just want to spend time with you too. You know what I mean? So it's like, you almost have to work against people missing you and like wanting you to be there, and like you want to go to events, but you kind of can't. You have to have your provisions in place. And I think for a lot of people, they kind of feel this sense of, I don't know, like the odds are working against them in some way. They're just like, oh gosh, like if I do this, then okay, I might have fun, but I'm also going to be in my head the whole time, like I'm too far away or something like that.
Yeah. Morgan from Delaware asks, what is one way someone with a chronic illness, for specifics, they have spina bifida, can reduce their stress on bad body days from like pain and fatigue? P.S. Love the podcast. So how can we kind of manage our stress on bad chronic illness days? Just kind of generalizing that a little bit.
I mean, the first thought I had was what K10 already alluded to, like that time-based pacing. One, to hopefully prevent worse or lessen the likelihood of worse days. But like, listen to your body. Like I tell people all the time, the thing about chronic illnesses, there is unpredictability. And if you have expectations of accomplishing X, Y, and Z tasks on a bad chronic illness day, and those are the same tasks you expect to complete on a better day, like that's unrealistic expectations. And pushing yourself too far is going to make the pain and fatigue worse. Yeah. So sometimes resting is the best thing you can do. And like nourishing your body, hydrating, all those like different things.
That's usually what I say. It's like going back to basics. Like, what do you need to do right now that's going to keep you alive?
Yep.
So using the bathroom, eating, drinking, and breathing.
Yeah. I even think like reducing like the shame that you might experience, or like the guilt that you might experience based on the pain that you're experiencing. Like the last thing that you need is to feel bad about yourself on top of feeling bad physically, or mentally or emotionally, So I think for some people, I'm thinking of a couple of clients in mind that I've worked with in the past. They would feel like, okay, if I have a bad day, like a bad chronic illness day, then I'm going to feel bad about myself. And then I'm also going to, you go down that rabbit hole. So I think even like to KBI's point, having provisions in place emotionally, like, is it good to call a friend who's going to make you feel better, or, I don't know, watch a movie that you really enjoy, something like that, to get your headspace put your head in a space where you could feel loving about yourself rather than feeling shame.
Yeah.
I'm also a big believer in the research around mindfulness stress reduction for chronic pain. That is really how it got integrated here in America by John Kabat-Zinn up at the University of Massachusetts. He started doing mindfulness interventions with chronic pain patients, is who he began practicing mindfulness with. And that's how it became more and more integrated in our American healthcare system and mental health system. But it seems counterintuitive. But when people use mindfulness interventions and go through mindfulness trainings, they're taught to go towards their pain, get curious about it, breathe into it, listen to it. It parallels what we know about psychotherapy is we go towards our problems, look at them, hold them, even our emotional pain and problems. There's something that we don't quite understand fully yet about the mechanism of being able to breathe, sit with, and compassionately listen to our pain that tends to do something different than avoiding and covering up. And there's ample research on this now, even if we don't quite understand the mechanism. I have theories, and it's not like I created these, but I think when you practice mindfulness a lot, you're able to modulate the channel of the brain far better and easier than when our mind is taking us in a million different directions at any one time. It's very interesting. It's certainly been my experience, and having taught mindfulness-based stress reduction courses before, I've seen it and heard it time and time again. It's something to get curious about and look into.
I was like, K10 just like peaced out there for a second. I was like, where'd she go?
My dog has like been breathing by the door for the past like hour, and I'm like, just come in.
This person from Texas says, how can I navigate a conversation better when it comes to my undiagnosed chronic illness and a professional that isn't listening to me or being dismissive? Thank y'all so much for what you're doing with this podcast. It's taught me so much and has made me feel heard and less alone.
Yeah.
I have such a reaction. I'm trying to hold it back.
So the second part or first part? Because I feel like both would elicit very different responses.
Different.
The dismissive part, I'm like, who do I have to fight? Like,
K10's going to get a fist fight.
And K10 will fight. I have
she's scrappy.
Jess, don't talk about it.
I'm not
you
even talk about it. K10 had to regulate herself in front of me the first time we met.
Because
she was about to
throw down. I really was. I was like, okay, Jess has like 9 PhDs at this point. Like, I can't be weird in front of her, you know? Like, I have to just hold it together.
And then
she's
there's
not going to be my friend anymore. And then there's Kristen. I'm like, Kristen would have my back and she'd probably like roast me. But I think like, Jess would literally never talk to me again.
I'd be like, that was such a shitty punch, K10. What the fuck are you doing?
She went with the overhand.
Anyway.
But she will fight for her friends. All of that to say.
Yeah. And that's
I would never do an overhand. Like, go.
You would throw a stiff jab. I have no doubt.
What I would do is I would just kind of like come with like a left hook.
Wow.
And then just
left. Okay.
Well, because I'm ambidextrous. Like, so I would just come with a left boy. Anyway, go ahead.
I never see it coming.
Well, did you want to talk about your strong reaction to the dismissiveness?
No.
Other than fighting people? Okay.
It was such a setup for a pass, but okay.
This statement is going to come with a lot of privilege, but if a professional isn't listening to you, if there is another option, I would seek a second opinion. Or tell that professional, like, I would like to seek a second opinion, because my understanding is they can't say no. Like, if somebody in the hospital tells one of the doctors, like, they want a second opinion from somebody else, like, we have to honor that. Now there's talking about the American healthcare system. Insurance might not always cover that and stuff. So that's why I said it came with privilege. But even just explaining, you know, your feelings on it and just saying, like, you know, I feel like I'm not being heard or that my concerns are being dismissed. I've brought up X, Y, and Z. You keep saying it's this. I mean, Justin, and not to put you on the spot, but I know you brought this up earlier in KBI, you did as well, of just your experience of being told, oh, it's anxiety and stress.
Yes.
It's like, but it's not. Like, yes, I am stressed out because I don't know why I'm blacking out, but I'm not blacking out because of the stress.
Correct. Yeah. It's very frustrating. I think at a minimum, it's aggravating. It can feel minimizing. Don't let it lessen your truth. Like, I really, like, if there's anything you can soak in, your truth is the real thing.
Yeah.
Maybe their personality, their ego, or maybe even in the best light, they're just very convinced on a treatment path. You know, in the best light, they're just very convinced if we go down this treatment path, it's going to help you. But I still think there's a way you could do that and honor and be curious about, like, and just validate, tell the client, like, you might be right. You know, here's why I think X, Y, or Z, but I'm hearing what you're saying. But what Jess said is what I felt as well, of like, there comes a time where we try to switch to a different provider with any resource we have.
Annie from Germany asks, what can you do as a friend or a therapist to make someone with a chronic illness feel understood or better about their condition if they struggle?
That's such a cute question. I love that.
I love that.
My first thought is to listen to understand rather than to like try to help, you know, because likely that person has like went to a million doctor's appointments, have Googled everything. You know what I mean? Like, there's just, I'm sure maybe they want solutions if they ask, but they probably want somebody to hear them and really take, kind of like what Justin and you guys were saying before, like, take what they're saying as the valid truth and just kind of roll with that. Like, whatever they're saying to you, you believe it, you know? wow, that must feel really hard, or wow, the pain does sound like really, really crazy. That's really hard, and really just validating that, even if you don't know what it feels like. I think that would be helpful.
Mm-hmm.
Spend a little time. Yeah, Google a little bit. Watch a YouTube video or two. Like, you can't know how far that could take you. It's not to say like, oh, the YouTube video must exactly match my friend's experience. No, but it matters. It matters in the hearing someone, absorbing someone. Like, how much time do we spend looking at useless crap on social media? You could spend 20 minutes watching a couple YouTube videos. It just goes a long way. If this is someone you care about, spending a little bit of time on the internet instead of scrolling, watching endless trends of Tube Girl on TikTok. Do we not know what that is?
No, I know what Tube Girl is. What? You're not on Tube? How are you not on Tube Girl TikTok?
It's the most viral trend on TikTok right now. How do
Wait,
you?
what is
I'm judging you, KBI?
Yeah.
You know everything.
Oh my God, be nice, guys! Stop fighting. Wait, what is it called?
I've
You
never
were just talking about fighting. It's Tube Girl. It's
Tube
like
Girl.
this weird, like,
She invented a new trend that everybody's doing on social media.
I don't know how to do it.
I've never not seen KBI know what's happening on TikTok.
KBI knows everything about social
and I
media,
might know
so
what
this
it
is.
I might just not know the name.
No, like, yeah.
Everybody's duetting it and saying, I'm doing Tube Girl, like Tube Girl, like.
Yeah.
What are you guys talking about?
Tube Girl. We'll have an
she created
intervention
a new
after we
form
recorded.
of content. It's a new form of content. Tube Girl.
Yes, Tube Girl.
I've seen her.
Oh, okay.
She is fine, by the way.
I look away from those because they make me dizzy.
Okay.
I feel like I'm on a roller coaster.
But everybody's doing it. I mean,
so I scroll past it.
Oh my God, there's so many people doing it.
Yeah, everybody. I mean, listen, all the kids.
Yeah,
everybody's doing it. KBI. I'm judging you too now.
She's going to do it.
How about everybody on this podcast? Give up. Thank you.
I love you too. I'll translate. I really care about you as well.
Compassionate.
So is that when my mom told me that? Is that what she meant too?
Oh my
I knew you were going to
gosh.
say it. I knew you were going to say it.
Could have been.
To bring us back, I want to add one more thing to the question about how to support a friend. Sometimes I think too, just even asking, I think it's important to listen, do your research, but like asking your friend in their particular experience, like, what can I do to help? How can I best support you? Because for some people, it's just, I just need to listen. For others, depending on the chronic illness, is like, it's actually going to be really helpful for me if, like, during pain flares, like, if you could come over and help with tasks around the house, or like, depending on the relationship and things like that. Because like Justin said, like, you can learn so much from watching YouTube videos and Googling.
Yeah.
And every single individual with a chronic illness has their own individual experience.
And I would like to add to that, like, if you put that out, like, and if you put that offer out there, like, can I come over and help you with anything? If you say those words, you need to be prepared for what the answer is and to go over and follow through with it as much as you can.
Absolutely.
Like if you say, can I come over and help? And they say, yeah, actually, I would love help cleaning my living room. That you're going over and then you're not trying to backpedal out of it. And if maybe cleaning a whole living room and that could take 2 hours, maybe you don't have 2 hours, you can say, hey, I only have an hour, but I can come and help you for that hour. But also making sure that, like, making sure of what your wordage is so you're not inherently shaming. Because even saying something in jest can be shaming to someone in a chronic illness. So maybe they cancel plans. And you kind of say, like, again, in jest of like, oh, you cancel plans again. Like, I knew it. Like that, like that can still come across to someone that you might be trying to poke fun over something that you knew was going to happen and you all poke fun at, but it inherently is shameful.
Good point.
True.
Okay. Elizabeth from Pennsylvania asks, how do you work with those with severe chronic pain who also struggle with suicidality?
This one's hard.
Yeah. I'm thinking of all the clients I've had, and every single one of them look different. So I'm trying to you know. I think if I could just generalize, especially with chronic pain, and chronic pain looks different for everybody, but I think really trying to not even instill hope, but find what that person feels hopeful about outside of the bubble of chronic pain. So like I always do a big circle and I'll put all the bubbles that are in their life. Like pain is one of them, you know, and maybe it's really big. It's taken up like the whole circle. And there's these other things in your life, really trying to focus, not diminish the pain that you have, acknowledge it's there, it's not going anywhere, but try to make those other bubbles a little bigger, you know, of like maybe spending time with friends or, you know, doing something that you enjoy, really trying to focus on those things. While also acknowledging like, yeah, if I had pain like that, I'd probably feel the same way. You know, that's really hard.
Mm-hmm. For me, it is the endless curiosity of understanding in your experience of the chronic pain. Yeah. Because we have the time and the space and the energy. I agree with what Kate 10 said for sure. And if we're going to dive into your chronic pain, let's create the journal. Let's get curious. Let's notice the rise and falls. Let's understand its patterns. And the reason why that's important is we don't know what we don't know. And I'm like everyone else. When I'm just like going about my days, a lot of times I don't understand what's happening, but we can notice patterns and rises and falls. Even things where it's like, I wouldn't have thought that going to the park was going to impact my chronic pain. And yet when I was at the park, I experienced my pain differently. But that it seems minimal, it seems trivial. Like, why would it matter whether I'm at home watching TV versus at the park? Because things impact pain, just like things impact our emotions. Yeah. Lots of things do. But it's a lot of validation. It's a lot of like, I believe you, and let's get curious together. Because when we try things, when we experiment, that's when we allow opportunities for things just to be different. But having the energy to do that and having the courage in certain circumstances to do that can be waxing and waning, which is totally normal and needs to be validated.
Okay, last question from Haley from Germany. Do you have any suggestions on how to grieve things that might have been easier or different if you've gotten a certain diagnosis earlier in life? They gave us a little bit of paragraph, but basically they're in their mid-30s and they've kind of been collecting diagnoses, chronic health over their entire life, had a late diagnosis of autism and ADHD. And while that has given answers, also kind of dealing with that grief of what if I had this sooner? They also said, P.S. I love your podcast so much and looking forward to the new additional Google Scholar. I can't speak today. The new short sessions. I've learned a lot as a client and as a fellow counselor. Thank you so much for all you're doing.
Oh, so sweet.
Thank you, baby.
Thank you, Haley.
So how do we deal with that grief of getting those diagnoses maybe later in life after dealing with them for so long?
I think it's one of those things that some people may have a lot of grief about it, because I think with grief comes with like frustration of, oh, I could have gotten this treatment earlier, and what would my life have looked like if I knew this about myself? And when I've had these conversations with individuals, you know, it's validating that like frustration, grief, what ifs, and also kind of an acceptance that you can't go back in the past. You're valid in your feelings. And especially depending on the circumstance, and I don't know all of your circumstance, but like if you've been going to doctor after doctor after doctor after doctor and felt like dismissed and stuff, that adds a whole another layer. And kind of once you process those feelings, which are all very valid, the recognition, okay, I have the diagnosis now, and what can I do with that moving forward that I do have answers? Like, are there things that you would have done differently if you knew you had a diagnosis? Probably. And unfortunately, we can't go back in the past. Also, as we had a whole episode on grief, realize that grief is not linear. So, you know, you may experience more grief like when you're going to the doctor, and that's okay. And then you might have days that you're like, yes, I finally got answers and I'm just going to focus on moving forward. But it's not easy. And I wish I had like this is what you do. And that's what's going to solve it. But grief is complex. Chronic illness is complex.
Yeah. And you got to give grief the space. You got to give it the time and the energy to see what's there. That was exactly my story. I started first having bad migraines and headaches in my last year at Auburn. I got an MRI. They said nothing's wrong with you. And when I got my diagnosis 3 years later, I asked for that MRI from, I won't name the hospital, although I really want to, from just outside Auburn, Alabama. I asked for that MRI. I had the same dilation and ascension of my brain 3 years prior. It went misdiagnosed.
I know who I'm fighting now.
And it was...
Got my target.
My neurologist down here in South Florida instantly was like, this happens a lot, believe it or not.
Okay.
They just
so wild.
They didn't see it. Whoever read that MRI didn't see the kiari. And I'm lucky that over the course of 3 years, my symptoms went on a slow rise until I was doing intense kickboxing, and the exercise that I was doing every other day was causing the severe symptoms because my brain was sloshing against my brainstem. But
wow.
I'm lucky that for 3 years, the symptoms were pretty mild and rising. But I grieve that. I'm like, yo,
yeah.
It was like, but I know so many of you have similar stories and parallels. You have to give it time and space and air out that frustration. What would that have meant if you would have got it sooner? And I couldn't agree more with what Jess said. But giving that time and space allows you to turn towards what do you have control of in the now, and where can you put your energy in the now. But that doesn't mean you don't leave the space for all the things that come from that grief.
I resonate with that so much. Yeah.
So what you're saying is we're rolling up and rolling tide at this hospital, right?
Yeah.
Justin, you just say the word,
college.
I could get a little...
I know. I specifically said it because
She triggered me in a different way.
That was the whole point of it.
We're War Eagle all day, baby. Come on. Hey, Auburn's undefeated. Alabama has already lost. I'm just going to say that because things will change, but noted on this day, September 19th.
Got it.
Sports. Go sports.
Sports. Well, thanks for joining us, y'all. Please rate, review, subscribe, and share this with someone that you think might love hearing about chronic illness. And we're going to leave you with this question. Always remember to head to our Instagram. We love seeing your comments. What is one effective way that you or someone you know has managed their chronic illness? You could help somebody in the comments. So head over and comment. We love to hear your thoughts. I also want to say we're almost at our year, and it's been a beautiful journey. I'm so excited to be here with all of you. And I'm not going to cry, so I'm going to say see you next week in group therapy.
Bye.
Bye.